How can we prevent heat loss in preterm babies? To answer that question, we will discuss a research conducted in Brazil. Let's get started. Evaluation of 2 polyethylene bags in preventing admission hypothermia in preterm infants. A quasi-randomized clinical trial. This research was conducted by the following authors and was published in the Journal de Pediatria in the year 2023. The figure you are seeing is of the experiment they did on alive babies. We are going to discuss it. Research background. Admission hypothermia has been associated with serious neonatal complications. We will discuss this term, admission hypothermia, later, including brain injury, necrotizing enterocolitis, sepsis, and bronchopulmonary dysplasia, particularly in preterm infants. Notably, in this population, some studies described a reduction of 15 to 19% in the in-hospital mortality rate for every 1 degree Celsius increase in admission temperature. The most common and effective preventive auxiliary measure is the use of transparent plastic bags, as it allows the transference of radiant heat to the infant and reduces water evaporation and heat loss. The same effect is obtained by covering the infant's head using a cap, preferably made of wool. Rationale. Why did the authors choose this study? Most of the studies that supported this practice evaluated the use of polyethylene bags versus routine care, but only a few compared different plastic devices and their efficacy in preventing admission hypothermia. Moreover, the authors have no standardized type of plastic bag for neonatal assistance. Each one used what was available in their settings. Thereby, this study compared 2 polyethylene plastic bags to prevent hypothermia at neonatal unit admission in preterm infants born at less than 34 weeks gestation. The product that was used to experiment was the company called Vigan. They made a product called NeoHelp, also known as Neonatal Heat Loss Prevention Suit. NeoHelp is a polyethylene occlusive suit to prevent hypothermia of newborns. This is a sterile suit in which the baby is placed immediately after birth, without drying, before being admitted to the ICU. In this suit, heat loss due to environmental factors like evaporation, convection, conduction, and radiation is limited. NeoHelp consists of a double layer of polyethylene. The heat loss through radiation, convection, and evaporation is limited. A hood which limits the dispersion of heat by the head. A pre-formed foam which helps to keep the baby's airway open and provides a barrier against heat loss by conduction, while maintaining his position and offering comfort to the baby. The hypothesis of this study was: the authors hypothesized that the intervention bag would be more effective than the one commonly used, control, especially for infants with birth weight less than 1,000 grams. Why we chose this study? Preterm births are increasing. Hypothermia is a modifiable risk factor that can be prevented. The study evaluates a simple, low-cost intervention. It is especially relevant for resource-limited settings. Methodology. How was the research conducted? Design. The study was a prospective, quasi-randomized, unblinded clinical trial. The data was collected from June 2018 to September 2019. Setting. The data were collected at a NICU located in the following hospitals of Brazil. Participants. This study involved preterm infants between 24 and 33 weeks gestational age, with birth weight between 500 and 3,000 grams. Sample size. The sample was comprised 171 infants randomized into 2 groups, 76 in the intervention group and 95 in the control group. Main outcome measure. The primary outcome was admission hypothermia, defined as an axillary temperature at admission to the neonatal unit of less than 36.0 degrees Celsius. Hypothermia was considered if the admission temperature reached 37.5 degrees Celsius or more. Patients and methods. This study was carried out in the NICU located in a tertiary care centers in Brazil. The control group received the plastic bag commonly used in the hospital, made of a single layer of polyethylene. Soon after birth, the fontanelle area was dried. Then, a plastic cap was placed directly on the newborn's head, and a wool cap was on top. The intervention group received the NeoHelp device, consisting of a sterile double-layer polyethylene bag. The infant's head was covered by a plastic cap included in the kit, and a wool cap was placed on top. Inclusion and exclusion criteria. How the patients were selected. The study included preterm infants between 24 and 33 weeks gestational age, with birth weight between 500 and 3,000 grams. Infants with major malformation were excluded, as well as infants with an estimated birth weight more than 3,000 grams, since they did not fit in the control bag. Due to these criteria, the total participants were: the sample was comprised 171 infants randomized into 2 groups, 76 in the intervention group, and 95 in the control group. The procedure of the study was: briefly after birth, the preterm infants were placed in a conventional bassinet without drying, wrapped in a heated surgical drape, and transported to the stabilization room, following the Brazilian Pediatric Society guidelines applicable at the time of the study. Preterm infants were placed inside the plastic bag under a radiant warmer, and resuscitated or stabilized as needed. The bag was continuously closed, being removed only in the neonatal unit when the body temperature reached more than 36.5 degrees Celsius. The right upper limb was left out, where the pulse oximeter sensor was placed. Heated gases for ventilation were unavailable. The infant's temperature was measured in the axillary region in 2 time points, immediately before the newborn left the stabilization room and at admission to the neonatal unit, still inside the transport incubator. So the results were: there were significantly lower incidence of admission hypothermia in infants covered with the improved polyethylene bag, with an 86% reduction in the admission hypothermia rate, particularly for infants weighing more than 1,000 grams and more than 28 weeks gestation. There was a higher mean admission temperature in the improved bag group. The in-hospital mortality rate was similar between groups. So the author's conclusion was: the intervention polyethylene bag was more effective in preventing admission hypothermia. It's not like NeoHelp is the only standardized bag for preemies. There are many options. Some examples are: the Rabbit, the Neo Wrap, the local food bags available everywhere in the world. So the final take-home message was: the choice of covering material matters. Improved polyethylene bags are more effective in preventing heat loss in preterm neonates immediately after birth.